Hi, today's therapy talk is going to be by me, Keith Screen. I work at Life Care Centers of America, and we're going to talk about anosmia. So, anosmia is the fancy term for loss of sense of smell, and it has a lot of causes. Sometimes it could be polyps in the nose, it could be smoking. Medications can sometimes cause it, but the big one we're seeing is it's caused by COVID-19. And that is why we started being involved with it here in a long-term care facility. 55% of COVID-19 survivors have 3 or more long-standing symptoms after 3 months. Nearly 20% of those have the loss of sense of smell. So loss of sense of smell can really impact a person's quality of life. It makes it harder to taste food and is associated with your sense of taste, so food isn't as pleasurable. So we could see weight loss, decline in motivation to eat. It also doesn't allow you to smell if food isn't ready to eat or healthy to eat. For some of our employees or others that we've seen that have had it, they can't even tell if their children have to have their diaper changed or not. You couldn't tell if a gas leak was occurring. And another big component is that memory is compared to your sense of smell. So you can tell that by if you close your eyes while you're smelling a pumpkin pie, you can kind of see your grandparents there and maybe your grandma over the stove, and you can imagine your cousins around the table, and you can see and experience really your aunts and uncles and maybe parents at the Thanksgiving table. So again, it has a sense of memory impairment as well. So there's a lot of great research about what we call olfactory retraining. It's a fancy term for retraining your sense of smell. And it really isn't that complicated and can be done at home with some proper training. So here is kind of what we've been doing here and what it takes. So there's just a few supplies needed. I will tell you can buy kits online with instructions. They're $20 to $30. They're reasonable. They come with tracking sheets that give instructions, illustrations. Just look for olfactory retraining kits. Lots of them will show up, even on Amazon. Some of the other easy to shop websites have those kits readily available. For us, we have several residents and staff members that we wanted to work with, so we built our own. Only a few simple supplies needed. You need a glass jars, small couple ounce jars. They need to be amber in color. You don't want them to be plastic because plastic will interfere with the scent. If they're clear or not opaque, kind of like this is, that allows sunlight to come in and it will degrade the oils that we're going to be using for the training. So glass jars that are airtight are the first thing you need. You need some watercolor paper. You can get this at any hobby store. Sometimes even Walmart, larger stores will have it. It's what you would do watercolor painting on. It's very inexpensive, just a few dollars. You cut it into small discs and put them in the jars. And then you need some essential oils. And the oils, there are 4 specific ones. They always are the same when we first start, and they have to be pure essential oils. But the flavors, smells that we were looking for, and this is all research-based, would be lemon, eucalyptus, rose, and then clove. Those would be the 4 important starting oils that you want to use. There's a lot of research about them. They cover the spectrum of the scents that we can recognize as human beings, and that's what all the studies show, those 4 oils. There's a secondary group later once you kind of adapt and start learning how to do this, but that's where we're going to start. Our clinic also obviously treats fatigue, the weakness, the shortness of breath with incentive spirometry and pulmonary hygiene. We do a lot of the other techniques here to help the patients recover. The sense of smell is kind of something we do for fun during the rest breaks in between exercises, because it can be done in under a minute with each of these scents. So that's kind of how we've been using it. So just simply, you take your jar, and in this case, this is the rose jar, and you're going to open it up, and it has the essential oils inside, 5 or 6 drops into the watercolor. It's been a couple weeks, and this is still really strong. So you can have people who can smell, make sure when they open it, it's like, whoa, that's a lot. That's what you're looking for. You take the jar, and you're just going to, I have a picture here of a rose on it. You want the patient or yourself to imagine that object. So think about what a rose looks like, picture it in your head, and then you put it under your nose, close to your nose, not inside, and you just bunny sniff for 20 to 40 seconds. Bunny sniffing is kind of wrinkling your nose up and taking those really quick, rapid breaths. And you do that for 20 to 40 seconds. You do that with each scent, and again, every time you're picturing it, you're imagining it, you're helping that brain, the neuroplasticity, you're helping reprogram that brain. What's coming in is a rose, and thinking about it. It might be a little hard with cloves, unless, like in my family tradition, we would take oranges and put cloves in them and put them around the house because they smelled really nice around Christmas time. But that's the basics. You want to do that with the 4 of them, and you want to try to do this and keep track 3 to 4 times a day. So like after every meal and before bed, or other kind of, we do that a lot with patients where we kind of give them a specific task, like do this at this time, so that it becomes a habit and a ritual. You can do little tracking sheets, did it, control it. But you'll see a lot of results. Almost all of our patients have noticed an improvement in their smell. They start getting sometimes a burning almost sensation, sometimes a tingling, and then slowly they can tell the difference, and they're starting to recover. So it's important to try to do this within the first year. That's when we're going to see the best chance of recovery. And once the patient starts getting their sense of smell and can tell the different scents, we'll mix in the secondary ones, some lavender instead of rose, and another twin, for some of the other scents as well, and keep them on the process of gaining their sense of smell. So just a quick tip, how we've been doing it, having fun with it. Again, it's something easy you can do at home. I encourage people to look online, but certainly before that year period, try to get in and find a way to help their nose recover. And thanks for watching. Bye.